Well, thank you for that. I feel quite daunted now after that sort of initial billing in terms of all the wonderful things we're supposed to have done in Wales. But it really is it's a great pleasure to be here today and have the opportunity to share a few thoughts. In some ways, I kick off really from where in the same way that Duncan started, because if Duncan started in terms of your first 2 days in the NHS were on holiday, my first 2 days, the NHS was on strike for the first week actually, because it was September 1982, and I arrived at Neville Hall Hospital in Abergavenny. There was a miners' picket line, and as a management trainee, they wouldn't let me out. I had to sit in my accommodation for a week because people were fearful as to what a management trainee might do in that kind of environment. And the second thing was also just reflecting on how the world has moved on. I'm currently reading a book about Bill Shankly, the Liverpool football manager. It's my hometown, it's my team. Fantastic book about Bill Shankly. And I was reading one of the early chapters of the day, and it was about the 1962 season, April 1962, which was the year that Liverpool were promoted back to the old First Division from the Second Division, where they'd been for a number of years. And it was the run into the end of the season, and there was a piece in the book, and it talked about Liverpool's match in April 1962 against Swansea Town, which also tells you something about how Welsh football has moved on, was postponed because of a smallpox outbreak in South Wales. And I just thought, that's astonishing. You know? I actually tweeted on, show how modern I am, I tweeted about that in terms of that sort of bringing together the change in football and the change in sort of public health circumstance. Also, I think many of the things that Duncan has talked about in terms of the sort of challenges that we face, I can say true for Wales. And in some senses, I think the scale of our challenges are probably larger. If you look at some of the key data, you know, nearly a quarter of our adult population still smokes. If you live in one of the lowest fifth in terms of deprivation status of our population, you are twice as likely to die prematurely as if you're in the most affluent fifth of population, and so on and so on and so on. I could talk at great length about that in terms of the challenges that we face in a relatively small health economy, supporting 3 million people. But what I wanted to do was just to focus a little bit on how things are in I was told not to point it at that, otherwise it won't work. I'm pointing it at, there we go. Just to give you a sort of a quick run through really, the context in which we operate in Wales, a little bit about our system, because it's different, and people may want to sort of pick up on that in questions at the end, and say a little bit about some of the successes and challenges that we've got, but then just finish with a few of the things which might change in Wales, because this is a very fluid, very movable feast. 1999 devolution, famously called a process, not an event, and that's right, because things continue to change. The competencies of Welsh Government continue to change in terms of its legislative powers and so on and so forth. And in 2010, very significantly, the National Assembly for Wales and Welsh Government acquired primary lawmaking powers. The budget, as you can see, has changed quite dramatically since those early days. But I'll come on to this in a moment or two in terms of challenges. At the moment, that is now absolutely flatlined in terms of the devolution settlement. In fact, in real terms, Wales is now receiving less through the devolution settlement than it has been before. So there are some particular challenges that we're now faced with as the consequences of the Barnett and how the Barnett formula works. Oops. As far as NHS Wales is concerned, I was billed as having all this experience in terms of 4 years and longevity as a CEO. Maybe that is in these days. To me, it feels like yesterday since I took up post. And like Duncan again, I still feel very humble. Public health is not my background. I'm a career NHS manager. And I'm learning things every day about public health in Wales. But nonetheless, Public Health Wales as a body was created 4 years ago. First time we've had a national public health agency in Wales. We're not the same as Public Health England. The relationship we have with Welsh Government is different. But nonetheless, my sense is that it put public health at the top table in Wales in a way that had not been the case certainly in the decade prior to that, where actually we were taking money out of public health in Wales after the dissolution of our health authorities in 2003. We now have a system in Wales which is based on 7 fully integrated health boards. It's a fantastic opportunity, linking everything from primary care through to specialised services. Those boards have population health responsibilities. I don't think anybody in Wales would yet say that we have fully exploited the benefits of the organisational model that we have. We don't have commissioner-provider. That was one of the key changes that happened in 2009, and I think the jury is still out on that one in terms of whether that's right or whether that was the wrong move. And in some ways, we are reinventing commissioning as we speak in Wales and some of the skill sets that go with that. But the 7 integrated health boards is a key feature of our system, and 3 specialist organisations, one of which is mine, Public Health Wales. The fact that we're an NHS trust, don't worry about that. It's a kind of an irrelevance, really. It was just that back then there were only 3 legal vehicles that could be used to set up public bodies, NHS bodies in Wales, and the trust model gave us the most flexibility. So there's nothing more significant than that. But our public health system, formally, I suppose, 4 key components. I work very closely with Ruth Hudson, our Chief Medical Officer in Wales and Welsh Government. And really over the last year, 18 months, we've been in a steady process of the transfer of functions from Welsh Government into Public Health Wales. It says on there we have a budget of £100 million, which is teeny tiny, really, small in a Welsh context in terms of health budgets. But when we started, that was £70 million. So we have been growing as an organisation. The functions have transferred into the organisation. My organisation is about 1,400 people across 40 sites Wales-wide. One of the complexities in our system, I think a lot of people look in at Wales and think, oh, you've got this neat, tidy system of integrated health boards and a national public health body. It's not quite as straightforward as that. We have directors of public health who are executive directors of those health boards employed by the health board. Their staff are employed by me. And the local teams that we have are from Public Health Wales. The directors work through us or through to us on an honorary contract basis. And again, I think it'll be a theme for these talks. It's all about people, and it's all about relationships in terms of making what could be quite a complex organisational arrangement work. And I think, by and large, we have, but it's not perfect. 22 local authorities in Wales is a real challenge for us in terms of the complexity or just the sheer number of relationships. And in fact, if you go back to the health reforms of 2009, to some extent, local government was disappointed in the structural change that took place, because in our old organisational model, we had 22 local health boards who were coterminous with local authorities, work side by side with them. And it's a challenge in the model that we have now about how 7 local health boards and a national body like ourselves works with 22 unitary local authorities. And I think it's still probably a weakness in our system. Public Health Wales, the outcomes that we're working towards, a healthier, happier, fairer Wales. We talk about doing that in 3 ways. We have a leadership role clearly across the system. It's our responsibility to mobilise partners and other agencies. And also we're a delivery organisation. 75% of my budget is actually in service delivery. And you can see there the sorts of things that make up Public Health Wales. We run all of the national screening programmes. That's actually about half of the organisation in financial terms. We run most of the microbiology laboratories across Wales, and we're working towards the development of an all-Wales network for microbiology. Health protection, which I think is one of the things we believe we do particularly well in Wales. Safeguarding, we run some national support services there in terms of children's safeguarding. Health and healthcare improvement, health intelligence, policy research and development. They're the main directorate headings that I have inside Public Health Wales. And the graphic on the right there, which I don't expect you to read, will appear on our website shortly, because it's a refreshed sort of strategy paper that we've just done, and that's it. That's not the front cover to a book. It's on 1 page. So that was my goal, to get strategy on a page. So I think it's worth a read when you can access that properly. Some successes. Just a couple of things to illustrate different points, really. We recently, as you are probably well aware, there was a major outbreak, a major measles outbreak across South Wales, or large parts of Wales, which was a tremendous challenge to us and to health boards, given our scale and the scale of the problem that we were facing. And there was some particular history to that in terms of low uptake of vaccinations 10, 15 years ago, back in the aftermath of the Wakefield business and so on and so forth, in Swansea in particular. But it was an example of a small system being quite fleet of foot. Good work in relationships with health boards, being able to respond very, very rapidly, and delivering, as you can see from the slide, 75,000 unscheduled MMR vaccinations across a very short period of time. And we've now got our highest ever MMR uptake rates in Wales. We're at and around 95% across the country now in terms of first MMR1 and over 90% in terms of MMR2. So that's been a success out of a major problem. Teenage pregnancies, teenage conceptions, often one of the things that was pointed to in Wales in terms of a kind of a wicked issue, a real problem. And we've seen a very significant reduction over the last 3 years. Why? Because we had intervention that worked, and we targeted resources at a particular group within the group. And we've achieved a very significant shift in some of our communities in a short period of time. And I highlight that because I think we can still get very gloomy about the scale of the challenge and some of these problems, and that we can't make an impact on these, but we can, and that's an example of where we have. And some of our screening programs, I think all of our screening programs, it's a bit of a jewel in the crown really in Wales, in terms of, I think, genuinely sort of world-class services that we run and some of the outcomes from those. But as I said at the start, you know, we have massive challenges still. System challenges. Our system isn't as clear as it might appear from the outside in terms of accountabilities. So we continue to work at the relationship with Welsh Government. We continue to work at the relationship with our health boards and with our local authorities. And there are issues in there about who owns the problem and, you know, to what extent we share that. And we've still got a great deal of work to do, I think, in Wales around aligning ourselves in the system around our priority areas. We're 4 years old, Public Health Wales, but it doesn't feel like it. It still feels very early days for us. And the organisational development agenda associated with creating the organisation and moving it forward still occupies a great deal of my time. And as everybody else, austerity is really biting. The health challenges I touched on at the outset, so I don't need to dwell on these particularly. But Wales is a very varied country. The differences between our sort of urban, our valley communities, our rural areas, health outcomes are very different across Wales. But heavily skewed by the post-industrial legacy, the ending of extractive industries and steel and so on and so forth in our valley communities. And this article I picked up just a few months ago that was published on the BBC website, the unbearable sadness of the Welsh valleys, just talking about the depth of some of the problems that those communities still face and still show in the data whenever you look at health in Wales and health outcomes in Wales. And there was a quote in that article, I should have put it up on a slide actually, I think it was a local councillor from Merthyr Tydfil who said, you know, we're still top of every league table we don't want to be top of. Interestingly, one of those used to be teenage pregnancies, but I don't think it is anymore. There are issues in our community about low resilience. We've just done a major piece of work around unscheduled care because Wales was facing the same problems as everywhere else in the UK over this last winter. And everybody's saying it's because the population's getting older. Well, actually, it wasn't really borne out in the analysis of the data. It's partial effect. But what we were seeing was a clear relationship between inappropriate admissions to hospital or attendances and deprivation and so on, and issues in our communities around things like fuel poverty, poor quality housing, and so on, resulting in a lack of resilience in some of our communities. So as I said earlier, you know, all the same problems that England and the rest of the UK faces, though to some extent worse. And our issue around inequalities, yes, people are living longer in Wales, life expectancy is increasing, but the gap is widening. In our capital city, in Cardiff, there is a 10-year difference between Dinas Powys, one of the more affluent parts of Cardiff, and Grangetown. I've got my little train line map as well, which shows that, others have done. So the depth of the issues around inequalities are really still a major challenge for us. Financial, I don't particularly want to dwell on this other than to say these are absolutely unprecedented times for us. Wales has often been criticised over the last 10, 15 years for spending more per head on health with poorer outcomes than England. This is the first year, certainly for 10, 15 years, where health spending per capita in Wales falls below that of England. The graphs have crossed, and that's not taking need into account. So we are struggling financially in a very big way. The NHS in Wales has had a flat cash financial settlement for 3 years. No inflation, no nothing, flat cash. So in real terms, we've been cut year on year. So there is no money. It's tough. And I've been in the NHS for 30 years and have not experienced issues like this and the depth of problems that we have. I think where that plays into my work in particular is, and I'll say it in my one of my final comments, is it makes making the case for prevention that much more important, but also that much tougher when our NHS services are under the financial pressures that they have. And one thing that is particularly clear to us is that the money we spend on health improvement, whether that's nationally through some of our national programs like Healthy Schools or Exercise Refer or whatever, and locally, is relatively speaking very small. Doing like-for-like comparisons is very difficult, but it's probably less than half of what is spent per head of population in England. Oops. A couple of final slides. I've talked a bit about relationships across the public service and have said that there are still issues for us in terms of how we work with other agencies. We have a commission sitting in Wales at the moment, the Public Services Commission, chaired by another former director of the NHS in Wales, Sir Paul Williams, looking at the long-term vision for public services in Wales. And they will report early in the new year. We don't know at this stage what they're going to say, but these are the sorts of issues that they are looking at. I think it's highly likely that there will be recommendations about local government organisational change. I think everybody expects that. So whether local government will move to the health geography of 7 health boards or whether it will be something different, but we will see some migration toward one another, I think, in terms of geographies. There feels like there is a long-term move in Wales, but it's never really been articulated towards integrated public service bodies. And it'll be interesting to see what the Commission has to say about that. We're already doing lots of things together. Leadership development, for example. Academy Wales is pan-public service in terms of the approach that it takes. So this is a really important one, and I think we'll have something to say about where public health sits in the system. And it would be no great surprise to you that colleagues in local government in Wales are very interested in the way it's being done in England. And the Welsh Local Government Association is very interested in the way it's being done and the experiences from here. So that's something we have to embrace and debate. Legislation. I talked about devolution as a process, not an event. And the fact that a couple of years ago there is greater legislative competency in Wales, and what we've now had are a series of, there's many more than this actually, but a series of bills going through, most of which have implications for public health in a very positive way. The Active Travel Act, the Social Services and Wellbeing Bill, very importantly. The Future Generations Bill is actually about sustainable development. It was originally the Sustainable Development Bill. It's now the Future Generations Bill. And we are expecting there to be a public health bill. I'm advised that there will be a white paper, possibly later this year or early next. But in the programme 2014-15, we are now expecting there to be a public health bill in Wales. And so in terms of the public health system, the public health bill, assuming that happens, I think, as Duncan was talking before about duties and responsibilities, that it's likely to bring duties not just on the NHS but on public bodies across Wales in their entirety, and duties to consider health in all policies. Interestingly, what it won't necessarily do is give us the ability to, one of the specific questions that was asked of Duncan about alcohol pricing, for example, it won't necessarily give us the freedom to do some of those things on our own, because some of those issues sit outside of the framework of devolution and of legislative competency in Wales. Health improvement, I've talked about the fact that we have massive challenges, that we don't spend a great deal of money on it. And our biggest problem with health improvement, I think we have some fantastic programs in Wales. They all evaluate very well, the outcomes are good, but they're not at scale. And we have a huge problem about scaling our activity up to make an impact at a population level. And we need to shift. We've got to be more focused in terms of the areas that we are trying to achieve, and it will be done more through others rather than Public Health Wales in delivering. And I think our role as an organisation over time will probably move away from delivery through to enabling and helping others. So finally, just to sort of to conclude, I mentioned the issue about the case for prevention. It's a major piece of work we're going to try and do as an organisation this year. It shouldn't be hard, should it, really? I mean, I'm not sure we need to make the case for prevention. I think it's already there, the evidence is already there. But this is about hearts and minds and about persuading people in times of austerity that it is not just worth, it is absolutely necessary that we invest in prevention. It's part of the solution to the big problems that we face. Developing a new approach to health improvement for us in Wales is going to be critical because we can't sit back. I don't want to be sitting here or talking in 4 or 5 years' time and saying we haven't made an impact on some of the big problems that we're facing. I want more positive stories like the work on teenage pregnancies to be able to share with audiences like this. And we have to take advantage of sensible legislation alongside the other work that we do. Legislation isn't a panacea. Absolutely, I think we're absolutely clear about that, but nonetheless there's a place for it in the work that we do. I apologise if I've talked for too long, but I'll stop at that point and very happy to take questions. I'm not saying I'll answer them, but I'm very happy to take them.